One of the most disturbing elements of the Prohibition War is how it's made police the enemy of otherwise law-abiding cannabis consumers. Fortunately, one group of police officers knows the futility of prohibition and reaches out to educate the community and current law enforcement. Today, the Russ Belville Show visits with another speaker from Law Enforcement Against Prohibition with one clear message. Cops say legalize drugs.
Welcome back, everyone. Half past, and time for us to talk to another great speaker from Law Enforcement Against Prohibition. We got Patrick Heintz on the line. He's a former corrections officer and drug counselor out of Massachusetts. How you doing, Patrick?
Pretty well.
All right, welcome back to the show. And of course, the topic coming up, we're just less than 3 weeks away from marijuana election night 2014. We've got Oregon, we've got Alaska, we got Florida voting on both legalization and medical marijuana. And give us your perspective on this from out there on the East Coast, as how, New York and Boston, and how are these states up there looking toward our elections and how that might affect you guys in 2016?
Well, of course, everybody is aware that the attitudes on prohibition are changing, and not too soon, I suppose, after 40 years of failed policy and $1 trillion and, millions and millions of arrests and so forth. And nothing has changed. So it seems like it's just this horrific waste of resources with the grand accomplishment of nothing as far as, harm reduction or cessation. I think people are just all around the country, especially the electorate, are, in favor of some kind of reform. The problem, of course, is that since it's been a funding source for 40 years for different agencies and law enforcement and corrections, it's hard to back away from the trough for some of these entrenched people.
Addicted to the drug war funding, so to speak.
Exactly. Now, I worked as a licensed substance abuse counselor in corrections, and, one of the basic things about substance abuse and addiction is, there's a checklist. If you do this, you're addicted and so forth. And all of the things on the list that, you do it more and more, and it keeps getting worse and worse, or nothing improves. It interferes with the rest of your life, but you keep on doing it. It has a negative impact on the rest of your life, and you keep on doing it. And all of these checklists to determine if you're an addict, they apply to the war on drugs. Police departments, they keep arresting more and more people. And yet marijuana doesn't go away. Because they're prioritizing the war on drug activities and spending all the resources and times chasing nonviolent substance abusers, all the closure rates on all the dangerous crimes out there like murder and assault and breaking and entering and so forth, the closure rates on those things are all going up. So they're spending all their time chasing their tails in the drug war and neglecting public safety. So it's as if law enforcement is addicted to the war on drugs.
One of the talking points that we hear from the other side in their opposition to marijuana legalization is that it doesn't need to be a dichotomy. It doesn't have to be prohibition or legalization. There's some sort of third way, and they never really describe what it is, but it seems to involve rehab. It seems to involve this idea that we're shifting our priorities from incarceration to treatment and prevention. And what do you think about that?
Well, I think that is exactly the way to go. The problem is if you don't do it in a regulated environment, you keep the funding criminal enterprise. So we've been trying to treat a mental health issue, substance abusing, which is self-destructive behavior, and everybody agrees that it's personality adjustment disorder, a mental health issue, and so forth. But what other health issue do we declare war on in the United States and try and solve it with corrections and incarceration? Nothing. So what we need is a public health approach to addressing substance abuse in our culture. And the perfect example of this, of course, has been big tobacco. Mm-hmm. Now, we didn't declare war on big tobacco. We didn't start arresting people and make it illegal and so forth. We just gave people some accurate information. And as soon as the Surgeon General's report came out and we identified tobacco for what it was, it's a habit, it's self-destructive, and it causes deaths, we've reduced tobacco consumption in America from, in the 50s, it was somewhere around 75% of adults smoked tobacco, and through education and honesty, we've reduced tobacco consumption among adults in America from 75% down to 17%. And that's a public health model of intervention, harms reduction, and cessation. And that's how you do it. But you don't have to arrest people first to get them to stop smoking tobacco.
Let me play devil's advocate on that stat, because I use it a lot as well. I point out how much tobacco smoking has gone down. But one critical difference is that when you tell the truth about tobacco, you're telling the truth about something that's highly toxic and addictive. When you tell the truth about marijuana, you're talking about something that can have health benefits for some people and is non-toxic and non-addictive for most people. So telling the truth about it may not actually reduce use. It may increase use. Any thoughts on that?
Well, of course, all the models overseas, prove conclusively that that's not the case. And one example, for instance, is in Amsterdam, where for years, they have these cafes and people can buy hash and smoke hash and so forth. In that country, compared to America, the age of onset of first use in America is so much lower and so much higher, and the number of kids that are smoking it is minuscule compared to that of America. And when you talk to kids over there and ask them if they go to the cafes and smoke hash, they laugh like it's a joke, and they say, "Oh no, that's what the tourists do. It's corny." So and it's obvious now to almost everyone that marijuana does have a legitimate place in medicine, and that should be determined between a doctor and a patient. And the other thing is marijuana, just like alcohol, it should be up to rational adults to determine their relationship with these things based on some real information. So alcohol can be abused. We don't want people abusing it, but it's still available. If marijuana were treated like any other mood-altering substance, like tobacco or alcohol, I think people are not mindless lemmings, and just because it's legal, they're going to go out and become chronic, daily marijuana smokers. And in fact, all the polling done says that if all drugs were regulated and legal, would you start doing it? And it's like 0.1% or 0.6% of people say they might try heroin. But at least it would be regulated. Here's another problem with an unregulated environment. And so no matter how we regulate it, it should be regulated because, you talk about marijuana, but leaving all drug distribution as the purview of criminal organizations and syndicates is a bad idea. One of the most striking studies I recently read was about Molly, which is the party drug for raves and so forth. And kids will go to raves and they'll take Molly. The problem with that is because it's an unregulated environment, they went to all these raves, collected Molly, bought it, and then tested it. And it was like 85% of it was actually bath salts and methamphetamine with a little bit of heroin in it. Mm. And so because we refuse to take responsibility to regulate this market, and we leave that up to criminal organizations, sociopaths, we're putting our children's health in the hands of sociopaths because kids go to college and a significant percentage of them are going to do high-risk behaviors. So at least if it's a regulated, if they're going to use alcohol, they're going to get alcohol that we know what the alcohol content is, and it won't be grain alcohol, and they won't go blind for making a bad decision.
We're speaking with Patrick Heintz from Law Enforcement Against Prohibition. We've got about a minute left. Patrick, any other thoughts you'd like to leave our audience with?
Well, when I was counseling substance abusers, I said, well, listen, you've been following your plan for a long time, and it really hasn't worked. And, every time you get high, you don't get arrested, but every time you've been arrested, you've been high. So how about we come up with another plan, and you try following this plan for a while, and if you don't like that plan, you can always return to the disaster that has been your plan. So we've been following this disaster for 40 years. So I think we need to try something else. And if it doesn't work, we can always go back to the